All right, what's up, everybody? Brian Tong here, and this is kind of a little different from what we're normally used to doing because, look, coronavirus is everywhere. Everyone's talking about it. It's on your mind. It's on my mind. So I brought in a special guest. This is Doc Knock, Amir Naqvi. He's kind of a contributor and also listener to my Applebits XL audio podcast, and he's been a part of the show. So I wanted to bring in really an expert to talk about coronavirus and just kind of some of the things that we should be aware of, best practices. So Doc Knock in the house, thanks so much for hanging out with us, man.
Hey, Brian. Thank you so much for having me. I'm honestly honored to be back on the show.
No, I love having you here. And you know what? I just appreciate your time and what your community is doing here. I'd like you to just, first of all, introduce yourself because some people might be like, well, why should I listen to this guy? Is he
Sure.
legit? And so I like how you dressed
Yeah.
for the part, but I just tell
Oh,
them
thank you. Yeah. Yeah. I just picked this up at the costume
I
store
know.
down the street. Yeah. So yeah, actually my name is Amir Naqvi. I'm a board certified internal medicine physician and also cardiology fellow, finishing up training now at Ascension Providence Hospital in Michigan State University, as you can see on the coat. I will be starting practice actually a couple short months in the summer at Advocate Christ Hospital in the Chicago area. So yeah, I think this is a important topic. It's I'm sure that people might be even sick of hearing about it, but it's important, and we'll get into that a little bit. So
And I think there's a lot of people, though, that know about it. Obviously, they're watching the news, but there's a lot of people that still aren't fully educated. They might have a general idea about coronavirus and what's happening. So, could you maybe kind of give us some of that background and establish
Mhm.
kind of the foundation of what is coronavirus for our audience?
Yeah, for sure. So I do want to just say very quickly, this is a very rapidly changing situation. Literally hour to hour, we're getting updates. As of like yesterday, we had a pretty significant shortage in tests. And then actually Trump just declared a state of emergency, opened up a bunch more funding. And also the CDC kind of approved a second type of test. So that's something that's different just in 24 hours. Besides the fact that numbers are also changing a lot. So today is March 13th, and it might be, different story even in a couple days. But so I would say that, and I would also say, if there are any questions about this, you can always reach out to me. Actually, I'm on Twitter at AmirNaqvido. Instagram is the same, but otherwise, you really should ideally reach out to your physician. The CDC actually has a good call number if you have any questions. The website is great, or 1-800-CDC-INFO. Anyway, coronavirus, what is it? So you'll hear a couple different names, and they're really used interchangeably now. COVID-19 is commonly used. Novel coronavirus, SARS-CoV-2. These are all different names for the same thing. The reason why, so coronavirus is actually a family of viruses. It's something you've heard before, maybe SARS, which was big back in like 2003, MERS or Middle East Respiratory Syndrome, and actually even just the common cold. One of the most common reasons for common cold is a family of coronavirus, a member of the family of the coronavirus. So this is a different strain of that, and it's just mutated in such a way that it is particularly more infectious. So the two main things that we look at when we're talking about the effect that a virus can have, number one, obviously mortality rates is one. And right now this is around 1% most likely. There's, again, some fluid changes in terms of the numbers. Some numbers you might hear a little higher, 2 or 3. I think in reality it's probably closer to the 1. And as that compares, for example, to the flu that we get every year, usually that's somewhere around 0.15% or so. So this is several times actually more deadly. But SARS was actually more so. It was about 10% death rate, and Middle East
Wow.
Respiratory Syndrome was around 40. So very, very deadly. But what this lacks for in that department makes up for in transmission. So it tends to be pretty infectious. One person will infect usually 2 to 3 other people. So as a result, you're seeing it's already got numbers 10 times what SARS had in a quarter of the time. And so it's actually killed basically the same number of people. So I think a lot of that has to do with the fact that people are in the beginning can be asymptomatic. They won't have any symptoms at all, so they don't even know they have it, but they're infectious, so they'll be passing it on to other people. So that basically is why it's in the news everywhere, and why you're hearing so much about isolation and everything.
It's also been declared a pandemic, and can you
Hmm.
also kind of explain that, because not everyone knows. I was like, when I first heard, I'm like, pandemic. You know, even me being someone who's pretty much in the know and educated, I'm like, let me look this up. So can you explain
Yeah,
to people really what is a pandemic, and how it's different, and
yeah.
why we should maybe take this a little more seriously?
Yeah, you mentioned last week on the show actually the game pandemic, and it's funny actually. I remember that game, and
Hmm.
but anyway, in that case, your goal was to kill everyone. Obviously, you don't want that in a real world situation. A pandemic is basically, I mean, you've heard maybe the term epidemic. It basically has to do with the degree to which it affects the world population. So epidemic tends to be more in a certain region, that affects a number of people in a certain region. And then pandemic means that it's basically worldwide. So if you look right now, so far, it's affected around 140,000 people as of today. And it started out in Wuhan, China, as most people know. And so it was really at that point an epidemic in China. But it has since spread a lot. And kind of getting back to how effective it is, if we look at some of those numbers and how quickly it's spread, back in mid-February, there's only around 750 cases outside of China. By the end of February, it was around 6,000 cases,
Mm,
and now we're around 56,000 cases. So very
wow.
quickly ramping up and spreading. And it really, if you look at the map of the affected areas, it actually touches all continents, other than
Wow.
Antarctica, obviously.
Well, yeah, Antarctica, you guys are okay right now.
Yeah, maybe we
That's
should
kind
all
of,
move there.
maybe. I mean,
Yeah.
that's kind of insane to hear, because I
Hmm.
know it's spread everywhere, but when you say it's literally on every continent, it shows how rapidly this is advanced. The thing is, we're talking about it spreading. Apple themselves has done some things where they're shutting down, some of the classes. They've shut down all the stores in Italy for a while. They shut down stores in China. They even closed down their factories in China. Can you talk about, like, we know even here in the US, we don't exactly know the exact numbers of how far, quite honestly, it's spread because of testing, but how does this actually spread? And is this whole, stay indoors or don't go outside, is that some of the best advice? Why is it really spreading so quickly, or just the nature of it?
Right. So I think it's a combination of a couple things. In terms of how it spreads, most commonly it's from people sneezing or coughing. But as I mentioned earlier, frequently people may be not having any symptoms at all. And it's really, the idea is that it's what's called droplets. So if you have from really more breath or saliva or something like that, and a lot of times people might touch their face, they might touch, they uh, again, coughing, sneezing into their hand or something. They may touch a doorknob, or our phones, and someone else can touch the same object and get it from that. More frequently, it's actually just person-to-person contact from being in a close proximity. If somebody coughs, you might inhale it in. There's actually some suggestion that it may actually be spreading more than just that, but I think by far and away that's the most likely. There's I read an article this morning actually that there could be actually fecal oral, which sounds really gross, but basically it's people not washing their hands enough.
Mm.
And if get it with from food, you can get it that way. But I think that's a little bit less certain at this point. We know for sure that the biggest thing is droplet. So getting to the second part of the question, social isolation works basically because if you are more than 6 feet away from someone, you're less likely that when they cough or sneeze that it's going to reach that distance, and will be less likely to breathe it in. And then similarly, washing hands can help prevent. The most common things that you'll hear in terms of how to prevent it is washing your hands thoroughly, 20 seconds, soap and water, get your fingernails, get you the back of your hands. If you don't have soap and water nearby, sanitizer would work. And then also that 6 feet distance.
When you honestly, I've been washing my hands, but probably like 5 to 10 seconds. Like
Yeah,
20,
most
20 is
people do.
actually 20 is
20 is a
longer
long
than you
time.
think.
Yeah,
It's a
yeah,
long
20 is a
time.
long time. But I've heard a couple tips out there, like using singing the birthday song twice. I would honestly go crazy if I sang that
Wait.
as many
The
times a day as I do.
the
Like
normal
happy
one, or
birthday.
like happy birthday
Oh yeah,
to you. I could do that one too, right? I
I
mean,
like that better. I like that better.
20
I
seconds
don't
of
think I
that to
would get
drive people crazy.
I don't think I would get sick of it as much as the original.
That's true. That's true. So, after the washing the hands, I guess symptoms, right? What should people be aware
Mhm.
of? Because some people think they might have coronavirus when they don't. What are some of those things?
Yeah, that's an excellent question. I think, and what we're seeing actually is in terms of numbers, there are still other causes of getting, a cold or something like that. The influenza is still a big issue, and so in fact, in South Korea, a lot of the tests that they've done have been negative because they ended up testing positive for something
Mhm.
else. But that being said, it is important to be aware of this. So. Specifically with the COVID-19, people are typically reporting fevers as the most common thing. 90 to 99% of people will have a fever in terms of their symptoms. Other things are like cough. Around 60 to 80% of people have a cough. And then feeling just tired or fatigued, around 40 to 70%. Um, about a third of people will have a productive cough, meaning they'll have like, phlegm that they cough up. Things like nasal congestion, nausea, diarrhea, vomiting, those kind of things are a lot more rare, probably under 5%. Doesn't mean that it can exist. Actually, at one point, that was a thought, was they said, oh, somebody's coming in with like a typical cold with runny nose and that kind of thing. You don't even need to test, but we're finding that's actually not true. We are still going to test in those cases. It's just less likely. Um,
So,
and sorry, go
go no,
ahead.
go ahead. Go ahead.
I was going to say, so that is typically, the time course of this is that usually people in the beginning, they may be exposed and they might not even manifest any symptoms for the first 5 to 7 days, maybe even longer. But they could still be shedding the virus, meaning they're still infectious. And then usually around that week mark is when they'll start to have these symptoms of the fever, the cough, feeling tired. And then within a little bit, maybe another week or so of that, in certain population, about 20% of people will have it progress further to where they start to have symptoms of shortness of breath, and really symptoms of a pneumonia or a lower respiratory lung infection. And those people, about that, 20% of the total, will need to go to the hospital, and around 5% overall will be more critical to the point where they need to be in an intensive care unit.
Hmm.
And as I said, around a 1%, 1 to 2% death rate right now.
So the other thing, I'm going to kind of jump around a little bit because we have
Sure.
a lot of people here that, we love tech. We're always touching devices. We're going
Hmm.
in. I even jokingly said, like, look at an Apple store. Everyone touches everything. That's one of the
Oh
places
yeah.
you don't want to be in. But we also talk about our phone.
Hmm.
Are these, this is the thing that we touch all the time. Are these just germ magnets, or about our phones? Apple even, they kind of recalibrated what they talked about before. They're like, don't use any, certain types of wipes on your phone. But now, because recently of the coronavirus, they said, okay, we're going to recalibrate this. You can use Clorox wipes, 70% alcohol wipes.
Hmm.
What is it about these things that make them something that we need to be concerned about with coronavirus?
Yeah, it's probably something that we touch more than anything else during
Mm.
the day, right? I mean, we're constantly, the screen time will tell you how much you're every week, how much you're using it, and so we take it with us everywhere, and we do a good job about, well, some of us do a good job about washing our hands and things like that, but you will then touch this, and basically everything you've been touching all day, all the surface has been sitting on, has now been sort of collecting this. And so that's why the recommendation there is to clean the phone. And as you said last week, that Apple just recently kind of walked back. They're saying you should try to clean it with isopropyl alcohol wipe, or a Clorox wipe would work. They do say don't use bleach, because bleach
Mm.
can actually mess up the phone. But I think it's important, especially after you've been playing on the toilet with it. So
Who does that? Doc knock. I don't know. Anyone? No, no. The other thing here, we talked about the phones, but what about just in general people at risk? We've heard about older people or people with previous health conditions. Who's most susceptible by really being affected by kind of some of the more deadly effects of coronavirus?
Yeah. So the general population, everyone is basically susceptible to get sick, but the people that are much more likely to end up getting more severe disease or die are statistically the older patients, people generally above the age of 60. And then also people who have any smoking history, that's a big one. History of diabetes, heart disease, or heart failure. And someone who's had any kind of lung disease is going to be a little bit more at risk than, someone who wouldn't. So for example, if you've had asthma, maybe increases your risk slightly, but it wouldn't be as much as someone who, for example, has a weak heart.
And then,
But that being said, we do have cases of people who are younger, even in their 20s, who have had severe disease or died. And these
wow.
are people who have had no prior history of any other health issues.
And that's the other thing when we talk about coronavirus, even if you may come off as healthy before you get it, we really don't know. And it's for me this weekend I was supposed to go to Portland, have an awesome time there. There was going to be like a 5K race in Portland. Portland, like many cities, shut down all events where anything more than 250 people you can't attend. So just by being outside, we can be carriers, and we kind of have to. This is one of those few viruses I really feel like you got to think about others along with yourself, but maybe even sometimes before yourself, because there's a lot of people that carry it that don't show any signs that could then spread it, right?
Yeah, for sure. We're seeing that across really the world, but definitely in our own country here in the U.S., we're seeing. I'm in Michigan, and I think it was day before yesterday. Our governor had declared state of emergency, or maybe it was last night. Honestly, it's changing so fast, hard to keep up. But as of next week, schools are going to be closed.
That's right.
They did the same thing. They said no gatherings larger than 100 people. In Illinois, it's 250 right now, but it's the same sort of thing. Conferences are being closed. We were supposed to have American College of Cardiology meeting that I was supposed to go to in a couple of weeks, which is closed down. Social calendars freeing up pretty quick now. So we were supposed to go. We're supposed to be in Chicago this weekend. My wife had a baby shower to go to, which has been canceled, and so we're seeing that left and right for sure.
I saw the hashtag quarantine and chill flying around there. So
yeah,
have at it, Twitterverse. Have at it.
For
quarantine
sure.
and chill, right? Have
For
at
sure.
it.
Yeah, maybe a little bit of Netflix, and if you haven't yet, definitely Disney Plus. I know you're a big fan of that. Mandalorian's worth checking out for sure. Apple TV Plus. Yeah, I think that these streaming services are getting a little bump in revenue.
What about during these times, Contagion, right? Is that a
Yeah, Contagion is a movie. It came out in like 2011-ish, 2012. I don't think that's a good idea to watch right now. Might make you panic a little bit because it's a little more severe than what we're going through right now. Yeah.
My girlfriend, I wanted to actually rent it just because I was just like, hey, it's kind of interesting just to see how they portray it, because people have been referencing it in articles a lot, and my girlfriend's like, nope, we're not going to watch that right now. But the other thing is the reality of this coronavirus. I went to the grocery store last night. I specifically chose 1 a.m. because I didn't want to be around the crowds. Also, sometimes someone might make a move that gets you a little more nervous on edge. Even I was reaching for some cans of tuna, and there weren't very many people there. I know it's been crazy in other places, but I went to a normal shopping grocery store, Ralph's, very normal, not like a boutique one that might have some more stuff. And I reached for a tuna can, and it was just so normal. But a guy kind of shoved his hand right next to mine, bumped mine, and grabbed two.
Oh my god!
It kind of made me pause for a second, and it kind of escalates that edge. And I don't know if, in a weird way, being away from people has kind of helped. Right when I felt that, I'm like, oh man, I could only imagine if this happened in the morning when there were 300 people in the grocery store. All it takes is a few people to kind of get that little panic edge in them, and it escalates everyone else's. I mean, I've seen it in crowds before for other reasons. So is this something that we should be really, really I'm not scared about, but what's the appropriate fear, right? There's
Yeah.
some people on one spectrum, some people on the other.
Yeah, I think the vast majority of people fall in one camp or the other, and I think we kind of need to bring everyone sort of in the middle. So definitely not any cause for outright panic. If anything, that's just going to cause more problems, more
Mhm.
harm. And, I don't really understand the whole hoarding toilet paper thing. That's, you got to have a little bit, but this is like how many rolls of toilet paper. I saw a meme out there actually, where there's a doctor who's talking to a patient and he's like, I'm sorry to tell you have coronavirus. And she's like, how is that possible? I bought 200 rolls of toilet paper. So,
It's to me, it's a psychological thing. Like there's a lot of uncertainty, panic, uncomfortability, and people feel
yeah,
like
for sure.
buy something to make them feel better about the situation, even if
Right.
it's exactly the same.
Yeah. I mean, I do think that there's something about being prepared. And that's not unique to this situation. I mean, there could be a natural disaster or something like that where the shops are closed or whatever. So I think it's a good idea to have some level of preparedness in the sense that, you should, especially in this case, have, if you're someone who's on chronic medications, have a couple months of
Mhm.
medications worth, having some clean drinking water or ability, I think for most of us in the US, it's not an issue, but, and then the biggest thing is really more like dry goods and food, in case, they put in like a strict lockdown where people aren't allowed out of the house. Thankfully, we're not there yet. And I don't think at this stage there's any need for that. I think that we can be somewhere in the middle where we're being careful about distancing ourselves from each other. Again, 6 feet, hand washing, and all of that, and just trying to cut out unnecessary social interaction. I think that's especially important for, again, some of those higher risk populations, like older people with diabetes or smoking history or things like that. I think that is especially important. But you kind of alluded to that fact that it's really important that we think of this not on a personal level. I had yesterday an interaction with a young girl who was saying, she was like, "Oh, but I'll be fine. We'll be fine, right? We're both young." But I think that it's important to move that mentality from, it's not just about us. Yes, chances are most of the people watching this probably will be fine, but our parents and our neighbors and things like that, we have to keep in mind that. And again, even younger people have even had more severe disease and died. So the best thing is to try to cut down the numbers. I have you may have seen this thing about the curves. Also, that's another important thing. I got this little drawing here, a little
Yeah,
ghetto, but a little ghetto,
little
but
little Doc Knock illustration for us today.
yeah, yeah. I anytime I draw anything for a patient, I will say I went to med school, not art school, so please forgive me. This is not really much of a drawing; it's more of a graph. But anyway, over here we have the number of people that are sick, and over here we have the amount of time. And so, really, what we're trying to have is a scenario where we have a slow spread of the disease that we try to control. Obviously, controlling numbers is part of it, but the biggest thing is the manner in which that happens. So if people are slowly getting sick and it spreads out over more time, even though the number of cases might be the same. If you look at this dashed line representing our hospital capacity, we're going to be able to handle it because it's not going to get jammed up. Whereas if all of a sudden overnight you've got a ton of cases, that's what's going to end up jamming up the hospital and causing issues. And that's unfortunately what happened in Italy. They
Mhm.
went from having their first case to within 2 weeks having around like 10,000
It's crazy.
cases. It's just overnight, and so you unfortunately have people in hallways in the hospitals. Like there's not enough resources or staff to be able to take care of everyone. So that's sort of the idea here about spreading it out. I think a good analogy is thinking about traffic. So, if you think about at rush hour, it's going to be a little more jammed, and as opposed to if you go look at like 2 in the morning, there's free passage of cars. You don't need to worry about it. Now, if you imagine something like in Italy, it was like on top of being like 4 or 5 p.m. on the 405. Now you want you add like there's a huge convention in town or something like that where there's a ton of people. Like say the Olympics are there in LA or something like that,
or a BTS concert, or a BTS concert,
or BTS. Yeah, it's almost
same level.
almost as big of a size for the Olympics as a BTS concert. That's for sure.
It's totally true.
Yeah,
fact.
totally
That's actually
true.
a fact. That's actually a fact.
Yeah. So yeah, but that's exactly the same thing. It's like, we're trying to keep it to a pace that we can keep up with resources. So
are there kind of any best practices? I mean, I know here's what I'm curious about. We talked about the phone, cleaning your phone, but I still don't see everyone constantly cleaning their phone. I don't know. I think it might help, but are there any general best practices that people should be aware of? And if cleaning your phone and your devices is part of that, that's cool. But what are you kind of thinking right now?
Yeah. So by far and away, the most important thing is just the distance of 6 feet and washing hands very thoroughly. There's been a big to do about masks, face masks, and I think for the general public, there's really no benefit to a regular face mask, right? Majority of these masks, there's really two types. The majority of these masks are these surgical masks that we wear, for example, in the operating room. And the purpose of that is to maintain a sterile environment. So we're trying to protect the patient from our breath. And so that is really not going to protect us as much. We will actually use those masks on a sick patient. We'll put them on the patient, and then it'll protect everyone else in the room from their breath and their coughing. The other type of mask is what's called an N95 mask, and they're supposed to form like a tight seal. And we will use that even in case of, like, for example, tuberculosis, where we're trying to completely form a complete seal and prevent any passage of air. They're really uncomfortable. And so what you'll see is in any kind of mask, we tend to really adjust it and play with it. And the danger there is that, particularly with the surgical masks, if you have those on and you touch something that is infected, when you play with that mask, you've now seeded that mask with that virus. And then it's basically trapping your breath in a room with that virus. So it pretty much almost can guarantee that you're going to get sick. So that's the downside, besides the fact that, as I mentioned, we only have a limited amount of resources. And we really need to try to protect the healthcare personnel, the people who are on the ground taking care of patients. If they get sick, then there's no one to staff the hospitals. And we're already potentially very easily going to be in a situation where we're going to be at capacity. I think one of the things that people don't really think about is that hospitals normally are not empty, right? We have only so many hospitals in this country, and in general, they tend to be pretty full as is. So what's being done as part of this whole process is people are trying to avoid, for example, elective procedures. So someone may have had, for example, a knee replacement or something that's scheduled. It may be delayed for a while. And that is all being done to basically free up space and free up resources so that we can have as many rooms and as many staff available for when this hits.
And that's the thing that also I think about, because due to limited testing that's been available, we really still don't know exactly how much this is spread in the U.S. My expectation, although I'm not an expert of that, it's only going to go up right now. We're not anywhere near
100%.
where that bell curve is evening out or even flattening in any way. So, part of this, people said, okay, stay home. People are working from home. Kids are staying in school. I'm choosing not to go out this weekend for myself and for others. Is this whole idea of quarantining ourselves, is that something we should start getting comfortable with for the next, I wouldn't even say 2 weeks, month, 2 months, 3 months, because we still, again, we don't really know here in the U.S. what the numbers are like.
Right. I agree. I think that there's no question that we're underestimating. I mean, I can tell you, even there's a number of patients that I've just seen in the own hospitals that I am covering that are under suspicion, and those are not being reported, right? So there's no question that we're underrepresenting the number. And the other thing is, a lot of people may either not have manifested symptoms yet, or it could just be kind of more mild and they're kind of just treating it at home. So for all of those reasons, we're underreporting the total number. I think that probably our best data is going to be coming out of South Korea. They're doing a very good job over there, and that's being sort of heralded as the example of how this should be responded to. But I think regardless of the numbers, we definitely do have to be comfortable with the idea of being isolated and being at home. I would strongly encourage, if there's ability to work from home, to do that. My wife's going to be doing that. I obviously can't do that, but yeah. And then, as I mentioned, schools are being closed in Michigan, at least. I think we might see that in a number of other places as well. Now that poses actually a difficult challenge, because obviously, healthcare workers are people too. We have our own kids and things like that. So that's one of the negative sides. But I think on the whole, trying to prevent children from sharing, tighter spaces with the rooms, even though they're statistically a little bit less likely to get it, or also less likely to spread it. We don't 100% know, but we think that they're also a source of holding the virus and giving it to other people. So even if they may not be as symptomatic themselves. And in terms of how long this is going to last, we really don't know. Our best guess, just looking at previous outbreaks. So SARS was, as I mentioned, is sort of a cousin virus to this, if you will. It's another coronavirus, and that tended to sort of die down in the summer. So we think that probably will happen, but we just don't know. We've really honestly never seen in our lifetimes anything on this scale. I think that what it's being most likened to is the Spanish flu, which was in 1918. So we're around 100 years from that. And I don't know. I don't remember it.
I honestly don't, but Asian don't raisin, so maybe I was there.
Yeah, that's right. Yeah.
So the other thing, right? I think because we're on the internet all the time, we see a lot of things, we hear a lot of things. Are there things that you've seen that may not necessarily be true? Like, there's stuff out there.
There have been some crazy things out there. There's this Facebook post that's been shared 200 times. That 200,000 times. That drinking water every 15 minutes will prevent you from getting it. I think it's good to stay hydrated, but that's not going to work.
You'll pee a lot.
You'll pee a lot. There's a fake UNICEF account that was there that avoiding heat. Sorry, opposite. Going towards heat, so like hot showers, or they even said like blowing yourself with a hairdryer. That could help prevent. It's not going to do anything.
Not true.
Garlic was another one I saw, that eating garlic prevents you from getting infection. It only could, in the sense that maybe people won't want to be around you, so just they're going to try to keep their distance from the smell. But that's, I mean, the garlic itself is not going to do anything.
Man, so. People will stay away. I mean, that's 6 foot. I would stay away from someone with that.
Yeah, 6 feet. 6 feet's a good healthy.
I also just wanted to say, for people in your profession and your line of work, I think we should acknowledge, you guys are working your butts off as a community to help resolve this, help find solutions for us. And you guys are under a lot of pressure, stress, duress. And, some people, they direct their frustrations in the wrong way. So I just want to say thank you to you, for being here and contributing all this knowledge for my audience and for people that watch this and listen to this, and B, just as a human, like, just thank you so much. So I just want to at least extend that appreciation,
That's very kind. I really can't take that much credit myself. It's really, this is a global effort, and there's a lot of people that are definitely there on the front lines. But yeah, I do appreciate that. I do want to say, if you think that you might be getting sick, then I would recommend calling your physician. I would call before you go in, because you don't want to go and infect a bunch of people. Same thing, calling local emergency department, or you can always call again the CDC, which is a 1-800-CDC info is the number. Their website is also fantastic. They've got some really nice handouts there that kind of review everything. Same thing with the WHO. All of these, WHO is a World Health Organization. All of these institutions that are there to help try to get a hold on this as soon as possible. So yeah, I think that the most important take-home message is it's not a zombie apocalypse. This is not the end of the world, but it is something to be taken seriously. And I think that the way that we can try to, manage this curve here is to try to isolate ourselves in the sense that trying to maintain 6 feet, avoiding unnecessary meetings, and definitely travel. I would be careful about, unless it's super important. Washing your hands 20 seconds, soap and water, get your fingernails, get the back of your hands, sanitizer if that's not available. Again, as we mentioned, think about our neighbors. This is not just about your own risk, but it's about the whole community. So proactivity is always better than reactivity.
Awesome. Well, thanks so much again, Doc Nock. Is there a place where people maybe can find you or contact you if they feel like it? I think some people might, just from hearing you talking. Again, thank you so much. Oh,
absolutely. Yeah, I'm happy. Not super active on social media, but definitely you can find me at AmirNaqvido at Twitter and Instagram.
So. All right. Well, there you go. Thank you again so much for your time, knowledge, and I'm sure this is going to help many people out that listen and just kind of wrap their heads around this, because we don't have all the time of the day to just sit in front. Well, some of us do sit in front of our computers and absorb content all the time. So just want to say thanks again and really appreciate it.
Thank you for having me so much.
All right. Big thanks again to Doc Nock for all that great information. And we didn't talk about it in the video, but afterwards he told me he wanted to make sure to let you all know that we shouldn't be shaking hands right now just to prevent the spread of the virus. It was just something that, we talked about so much, we missed some things. But I hope that was really helpful and informative to you. Again, things keep changing by the day, by the hour, but just be safe, take care of yourself, take care of others around you. And you know what? Just quarantine and chill. All right, everybody, if you like this, you know what to do. Give me that thumbs up, subs up, hit that notification bell, ding, for all my videos. Take care, everybody. Be safe, and we'll talk to you soon, all right? See you.